Hello, everyone. This is Jessica Rial with Southern Pelvic Health, and I am really excited to be doing our provider spotlight this month with Dr. Yogita Tailor. Dr. Tailor is a physiatrist, a medical doctor who is practicing at Pelvic Rehabilitation Medicine in Atlanta, which is a newer practice, and they have been just a wonderful practice to work with and are so passionate about helping with people with pelvic pain conditions and various pelvic health problems. So thank you so much for being here with me today, Dr. Tailor. I really appreciate it.
Thank you so much, Jessica, for having me. It's been such a pleasure working with you and your team, and I'm so excited to sit down and chat with you today about a little bit of what we do.
Awesome. So first, to just jump right into it, sometimes, I think the different names for different providers and different specialties can be a little bit confusing to patients. They have their urologist and then the colorectal specialist, urogynecologist, and your specialty is physiatry.
Yeah.
Can you talk just a little bit about what physiatry is, and then why someone who has a pelvic pain condition might benefit from working with a physiatrist with your specific training?
Absolutely. So, a physiatrist is a physician in the field of physical medicine and rehabilitation. And PM&R, as it's kind of abbreviated, is a relatively new specialty within medicine. It's been around at least for the last century. However, it's a specialty that's more dealing with function, not necessarily an organ system. So we treat kind of the gamut from head to toe, from patients with brain injury, traumatic brain injury, to back pain, knee pain, foot pain, and such, but our goal really has to do with function. And in our practice with pelvic rehabilitation medicine, we're looking very specifically and very closely with the pelvis and the pelvic floor and everything that kind of deals with the pelvis. Now, most people, when they think of the pelvis, they would not initially think of a physiatrist. You probably think of a GYN or a urologist or a GI doctor, and sometimes maybe even like an orthopedic doctor if it seems more like a hip issue. But we, as a physiatrist, we kind of look at kind of the whole picture, and kind of trying to figure out what the root cause is and how your pain or dysfunction is affecting your quality of life. So that's kind of our specialty and our kind of the uniqueness of it, where again, we're not focused on an organ system, but we're more focused on getting you a better quality of life and getting you to your most optimal function when it comes to pelvic pain.
That's awesome. And it's interesting because I think people with your specialty in many ways are very well equipped to be dealing with people, working with people with pelvic pain, because I think so many times people with pelvic pain, one of their struggles is that when they're seeing different specialists, they're wanting to just focus in on their organ system. And so they might see a urologist who's wanting to like live in their bladder problems, but they happen to have bladder problems as well as bowel problems, as well as some sexual concerns, as well as this like nagging hip and back pain. And I think your specialty, for what I've seen, even in the literature for your journals and that type of thing, they're really trying to be very comprehensive and putting the pieces together for patients, which I think is so often lacking when it comes to treatment and evaluation for people with pelvic pain conditions.
Absolutely. And our specialty in itself, we're very collaborative. Even
Yeah.
from the beginning of training, we are very much trained to work with a big team of providers. So physical therapists, occupational therapists, speech therapists, cognitive behavior therapists, as well as our other colleagues within the field of medicine. So again, we work very closely with our gynecology, urology, orthopedic colleagues in specifically for our pelvic pain patients to get these patients better.
And I think that that's so important. When we look at the research for people with pelvic pain, so many people really benefit from a multidisciplinary team,
Absolutely.
and we see that when everyone is collaborating, that's when people are getting better faster. And it's and I know you totally agree with me because we've had conversations about this in the past, but it just makes such a big difference for people when their providers are talking and when they're able to kind of see the specialists who need to target into a certain organ system, but then see people who are looking at their whole system and addressing different components of it too.
Absolutely. And I like to think of us as kind of like a quarterback, right? Where we're kind of managing a little bit of everything. I'm not necessarily a football specialist, but,
Not.
but at the same time, but like I kind of get the idea. Like the quarterback kind of has their eyes on everything. And again, as a physiatrist, like I'm kind of looking at like how one thing affects the other, and again, kind of working together to kind of get things moving so that we're actually making progress as opposed to just focusing on one part of the issue. Because oftentimes when you're dealing with chronic pelvic pain, there may be one initial root cause, but there's so many other factors that contribute to it, and especially with the chronicity of it. And so we really have to keep an open eye when we're dealing with chronic pelvic pain.
Absolutely. I tell a lot of patients that they end up in situations where they're kind of like onions, and you end up peeling back this layer, and then there's this layer, and there's this piece, and in order to kind of get to, okay, what's this, there might be a stimulus that caused things, but then everything can kind of spiral from there.
Absolutely.
Which I think is why it's one of the most rewarding populations to work with, because it is so impacting to people, but they can do really well and see good resolution of their symptoms and improve, which is amazing.
Absolutely. 100% agree.
Well, so, not there aren't a ton of physiatrists who specialize in pelvic health, like really specialize in it. And, I'm just curious a little bit about your journey. I know pelvic rehab medicine opened this past year in Atlanta, but what has been your journey in going down the road of really focusing your specialty on pelvic health?
Absolutely. So I finished my PM&R training, my physical medicine rehab training in 2013. And, there was so much about PM&R that I loved. And so I kind of did the general PM&R once I got out of residency. But as kind of I started doing my own practice, and I kind of had my hands on a lot of different things, kind of general musculoskeletal. I also did wound care, hyperbarics. But as my career was evolving and I was kind of seeing some of my patients, especially my patients with kind of that low back pain, that sacrum pain, or the hip pain, I was like, there's a lot more to this than we're really uncovering. And I was like, we really need to focus on kind of that pelvis, because there's so much musculoskeletal neurological aspect that as a physiatrist I have expertise in, but at the same time, like oftentimes patients go to their gynecologist, urologist. So while I was at my previous institution, I talked to my chair and I said, we really need to start this program, and I'd love to be, spearheading this. And during that time, I also had got pregnant with my first baby, and got a chance to feel for myself, what it is to have some pelvic discomfort. And
Yeah.
when you talk to your gynecologist, they may be aware of some of it, but there's a lot of other factors that I felt like I could contribute to as well. So we started that clinic in 2015. And when I was doing that, I visited kind of pelvic rehabilitation medicine. Our initial office is in New York City, and I visited there just to kind of get an idea of what we were doing here. And the advanced critical thinking that goes on, and kind of the devotion to pelvic pain was something that really resonated with me. And we started kind of working to kind of develop this clinic, and we eventually brought it here to Atlanta, and our office has been open since September. But I do, even though we're the only ones in Atlanta, I do have colleagues kind of throughout the country, primarily East Coast, that I love to kind of, work through ideas with, and we collaborate. And,
Yeah.
our leadership is very much involved with, even research opportunities and such. So it's been an amazing journey to kind of from where I began to where I am now, where I'm able to deal with pelvic pain and pelvic conditions kind of on a daily basis.
That's awesome. That's so awesome. So tell me just a little bit, if you don't mind sharing, about your approach when you have someone coming into your practice who has chronic pelvic pain.
Absolutely. So, like we kind of touched up on earlier, there are so many layers to a chronic pelvic pain patient. And my initial kind of evaluation with the patient really involves a lot of kind of sitting down and getting to know the journey of the patient. So, I can spend more than an hour with that patient, kind of going through their journey and how everything began. And sometimes we kind of pause a little bit, and I have to ask, what led up to, what the patient may perceive as been their chronic pelvic pain, because there's so many factors, even things in childhood, like an injury, a fall, even, chronic constipation that we may not think about necessarily having been being triggered for pelvic pain kind of on that initial thought. But I really get to spend a good amount of time really uncovering the layers, understanding, if it's a female, their GYN history, bowel function, bladder function for both males and females, even, their daily lives, what kind of work are they doing? Are they sitting all the time, or how active are they? Is there weightlifting involved? Kind of digging through kind of all the different little channels of what can contribute to pelvic pain and really uncovering that. And then the next part is examining the patient. So my exam typically involves starting off with a back evaluation, a hip evaluation, and again, we're looking for things that may be contributing to, nerve pain, or if there's a labral tear, or cam injury, or pincer injury in the hips. Then we're looking at the abdominal area, feeling the muscles in there, checking for any hernias, potential hernias, and then we do an external pelvic exam. And if we do a quick internal pelvic exam as well, in order to kind of help elucidate, the tension in the muscles and tenderness along some of the nerve areas. And then afterwards, we kind of sit down together and come up with a plan. And everyone's plan and treatment plan is unique, kind of depending on where they are in their journey and what they've tried and what they haven't tried. My treatment plan almost always, I don't think there is an exception really, always includes a physical therapist, a pelvic floor physical therapist as part of the treatment plan. And again, that hands-on manual treatment that you guys do is so important to helping getting these patients well. Because a lot of the pelvic area has, a lot of tension in there, and that manual release can provide great benefit. And then we think about what other, things that may help them get better faster. And the evidence has shown that a multimodal approach tends to work a lot more efficiently than kind of doing things one at a time, especially when have been dealing with this for years and sometimes even decades, where if we do the physical therapy in combination with sometimes muscle relaxants or neuromodulators or medicines that can calm down the nervous system, and oftentimes I'll include it as a suppository, so it's more directly affecting the pelvic floor. And then also talking about other things like, cushions and ways to manage constipation. Other things can include, oral medications for like bad flares, such as anti-inflammatories or even oral neuromodulators to help with the nerve aspect of it. And for certain situations, especially if the pain is really impacting quality of life or really has been going on for a really long time and there's been kind of a plateau in improvement, we can even offer an injection series that we do for some of the nerve areas, where our injections, we target both the nerves and the muscles kind of at the same time. So again, we're kind of approaching the pelvic pain from multiple standpoints, not just one.
That's awesome.
Yeah.
Yes. Yes. And it's, I do think that that multimodal approach can make a big difference. And we have some patients who we see, who might be a little bit, they maybe were making progress, and then we might have a little bit of a plateau. And sometimes I find that there can be simple things that make a big difference. And what sometimes they'll work with a provider and just add a suppository, and suddenly we see that progress was here, and now it's like, okay, and now we're working again, we're going where they just need a little bit of a boost, something to help them in their journey and stuff. So that's awesome. Now,
Absolutely.
yeah,
'Cause
no,
yeah, I mean, sometimes I have patients that say, "Oh, they did try PT, or they did try the suppository, they did try the medicine," but sometimes it was kind of done separately.
yes.
And I say, "Okay, let's try this all together and see a different kind of a journey through that."
Yes, and that's a good message, I think, for patients to hear, because sometimes I find that when I talk to some people, they can be a little bit hesitant to add other things in. So we're working and we're trying some things from what we can offer from a physical therapy standpoint. And we may encourage them to go see a provider and have them take a look and say, there might be some other stuff they can try. And I can tell that some people have resistance because they think that if I add something in, then I'm not going to know what's working. But what I don't think people realize is that it might be the added thing that actually helps the thing you're doing work better and get better faster. And we don't need to kind of take this scientific, let's try just a single thing approach. We can try to see if we can address things from all angles. We might actually make faster progress and better progress.
Absolutely. Because like we said, one thing affects the other. So if we're able to kind of affect two different or multiple different areas together, we'll have a greater impact on the symptoms.
Absolutely, absolutely. Now, I know we've talked so much in the past, and I know you're so passionate about working with people with so many different pelvic conditions. But do you have any certain populations that you're just really passionate about? And I would kind of already know the answer, but I would love for you to share it with our group here too.
Sure. So sometimes, it's so rewarding when a patient that has kind of gone through a really tough journey comes to you and we're able to kind of put pieces together and really get them starting to feel better after, feeling kind of hopeless and being able to provide them hope. That's been so rewarding doing what I do. And, the types of things that we're kind of, our goals that we're dealing with are sometimes very basic, like, being able to sit, being able to have intercourse, being able to, have a meal without having to get up to go to the bathroom multiple times. And so getting these patients better can be so rewarding. So some of the more challenging patients that, the more complex patients can be some of my favorite. And, a big part of the population, especially with our women, is the endometriosis population.
Mhm.
And endometriosis, is more common than most people think. And it's been so rewarding to see some of our younger patients come in earlier. And we've been able to kind of identify certain factors that make endometriosis a lot more likely. And unfortunately, endometriosis is a surgical diagnosis. There's not a great imaging or blood test or anything to really show that you may have endometriosis, at least not yet. There's some studies out that
There
hopefully,
are.
yes, that hopefully may make the diagnosis a little bit easier. But I love it when the patients are able to come early and we're able to kind of capture them and kind of prevent them from kind of going through a really long journey as well. So those are
Mhm.
my favorite patient populations.
I love it. I love it. Well, this has been so wonderful to talk with you today.
Absolutely.
So,
It's been so wonderful, Jessica.
yes. So tell me if patients are listening to this and they're interested in maybe getting your opinion and seeing what, if there's other things you might be able to add into their care, what's their best way to get in touch with you in your practice?
Absolutely. So our practice is a national practice. And if you go to our website, pelvic rehabilitation medicine.com, I'll share it with you until
Yeah.
hopefully Jessica
Yeah, we
will
can
be
put it in the
able,
notes.
yes. We can get in touch that way, or, we have a wonderful office coordinator and wonderful physician liaison that work with me to help kind of capture our patients, not necessarily not capture our patients, but to get
Just
our
their
patients, get
journey.
that communication going. So I'm very, very open to open communication and helping our community out. And we also offer televisits for patients that may not live close to one of our locations. We're in
Great.
Atlanta, but I've seen patients from Tennessee, South Carolina, North Carolina, Alabama.
That's awesome.
So
That's
telemedicine is also an option too.
perfect, perfect. And if you are currently working with a pelvic PT, or with someone else, make sure that you talk to them and let us know. If you listen and you're thinking, "Gosh, I really want to go see Dr. Taylor," give us a call and let us know that you're interested, so that we can communicate with Dr. Taylor about your case and let her know what's going on and stuff for you with our side of things. And that just really, I think, will help you in terms of evaluating your patient and knowing where they've been and what their journey's looking like.
Absolutely. Like I've told you, Jessica, like I love that open communication between
Well,
providers.
we do too. Yeah.
Yes, so we can provide the most ideal care.
Yeah. Yeah. Awesome. So if there's was one thing that you'd want to share with our community, we have a community of people in the metro Atlanta area, but then we have other people who've connected with us from other places, who often are dealing with pelvic health problems. What would you want to share with them?
Absolutely. So I just wanted to share, it's okay to be vulnerable. I know this is a very sensitive area, and sometimes there's a lot of fear in terms of even addressing pain when it comes to the pelvic area. It's okay to be vulnerable, but I encourage you to make those first baby steps, whether it's getting in touch with an excellent PT like Jessica or reaching out to us in order to have a better quality of life. So we are here for you. We are here to listen, and we are here to help you.
Awesome. Awesome. Thank you so much again. And this has been really wonderful. And I just really appreciate your time today talking with me.
Absolutely. I appreciate your opportunity, Jessica, and this has been
Absolutely.
wonderful.
Awesome. Awesome. Great. Well, have a wonderful day.
Thank you, you as well. Take care.